Hello, welcome again. This is the final short video on this series of World Diabetes Day 2024, courtesy of the University of Southern Queensland. The series has focused as part the world theme, well-being for a better diabetes life. You have watched the various videos put together by experts from the university. What I am just about to do here is a concluding recap. On behalf of the university and myself, I acknowledge the country, the First Nations of Southern Queensland and their elders, both past, present, and emerging. The first video of the series you watched took you through diabetes, a brief reminder of what diabetes is, the types of diabetes, and then the diabetes care and self-management. I do hope you found it interesting, especially because it has been provided. You would have noticed it has been provided not only by a registered nurse and diabetes educator, but also teamed up by our friend who lives with diabetes. So that lived experience, I am sure, will be beneficial to you and me, not only for those living with diabetes, but for those who are carers and supporting family members and friends. When we moved from there, Dr. Andrea Fuller, an accredited practicing dietitian, took us through the subject of diabetes and nutrition. Many of you, or almost all of you, know that we have professional dietitians, nutritionists, and that what you eat every day, you are making decisions, both conscious and subconscious. You keep on, or we keep on making decisions. So I am sure that this piece that an accredited professional practicing dietitian, Dr. Andrea Fuller, has presented, that we will come back to watch it over and over again, as we will do the previous one. And then we have yet another accredited exercise physiologist talking about exercise for diabetes control. Exercise for diabetes control cannot be overemphasized. Okay, and I am not here to repeat what Kyle had said, but I do hope that this piece of video will be a useful resource to all of us to come back again, to watch it again, and remind ourselves more about how exercise physiology will help us in diabetes control, not only for ourselves, but also for our family members and friends that we may be supporting. And then we have our dear friend who has briefly narrated his lived experience. You would have noticed that Fred emphasized on compliance or adherence to prescription. He also mentioned family support. Okay, so taking on from there, I want us to remember that there is actually what we call problem areas in diabetes, self-management assessment skill that you can use. Okay, if you just look for, or your clinician will tell you about this form that you can use for your self-management or for supportive management of a family or friend, a family member or friend that you care for. You will take note that we are talking well-being for a better diabetes life. And when you go through this form, out of the 20 questions, you will notice that feelings, how do you feel? How do I feel? It makes up 14 out of the 20 questions, which is technically 70%. Questions on food is there. You come down to patient health questionnaire, you see some questions like little interest or pleasure in doing things. When you think little interest or pleasure in walking around the block, physical activities, okay, we know that physical activities are good. This is where it comes in. So hopefully all of these should be a resource to us, and we hope we will come back to this and continue to refresh ourselves, not only for ourselves, but for our family members and friends that we are supporting in the diabetes self-management journey for their well-being, for a better diabetes life. Thank you.